apart from coronavirus as a communicable disease, we have others like bubonic deaths, we have CO2, we have SARS, we have Ebola, and other hemorrhagic fever. The good thing about the hemorrhagic fever is that they share in some characteristics. That is why a number of us that are into phytomedicine, who are probably handling HIV 1 and 2, decided that during the Ebola, let us find out if our combo combinations will have effects on the hemorrhagic fevers. And what did we do? 3 of our patients who are already undergoing HIV treatment, we took their blood sample to know their blood picture as they are undergoing this treatment. And we gave ourselves 3 months. So we gave them doses for 3 months. What did we find in the initial pictures we took? We found and documented their CD4 count, their CD8 count. The CD8 is particularly important for Ebola or hemorrhagic fever generally. The CD4 is for immune boosting, that is for HIV/AIDS. After 3 months, we did a repeated blood taking to see how the new blood pictures compared with the first one. What did we know? What did we get? We got the CD8 and the CD4 results, with CD4 doubling the initial one we took 3 months ago. What about CD8? The CD8 we got tripled. I can recall one who had 700. That is the CD8. At another test results, it was 2,149. And this is done in a highly specialized institution, which is a WHO approved center for herbal medicine in the whole of West Africa. The CD4, what does it teach us? It teaches us that it has the capacity to boost the immune system, whereas the CD8 relates to the hemorrhagic fever. If it does change the CD8, it means that it will be effective in the hemorrhagic fever. And that is what we got for the 3 patients. None of them gave us a negative result. So from this, we got to know that the herbal medicine or the phytomedicine or the food supplements have capacity to increase and boost the immune system, and also increase the CD8, which means it's effective in HIV. It's also effective in Ebola, and by extension, Corona. And it is still the same assumption we were working on when about a year ago, myself and some other phytomedicine practitioners declared stance on the Corona crisis and co. But that notwithstanding, of late, His Royal Highness, the Oni of Ife, came out with the same hypothesis that these things are natural and they have immune boosting capacity and they can deal in Corona. On the upper stand, I stand that phytomedicine can act as natural vaccine, and it can also act as immune booster, boosting the immune system beyond human imagination. I say this with all respect because this has been tested and proved in the test we did. So for sustainability, while we are taking our vaccine, we should also be developing and working hard on our phytomedicine so that if there are issues tomorrow that we cannot get out of our continent, out of our country, we should be able to self-depend on a number of herbs we have that has immune boosting capacity beyond human imagination. Even if you talk about the international perspective. This can help us limit the number of APIs we get from abroad to develop new medicines. We can work on what we have. If we are given chance to do our clinical trial, what the results will shock everybody in the world.